Here's Delaware Governor Jack Markell's weekly message.
Physical problems have a nasty habit of turning into fiscal problems. Whether it's lost wages for the employee, lost productivity for the employer, or rising bills for treatment that wind up increasing our premiums for everyone, sickness and disease carry a dramatic financial cost. The physical costs can be even more severe. Chronic pain, loss of mobility, susceptibility to depression, which raise the likelihood of more health problems. Chronic diseases like diabetes, hypertension, heart disease, and strokes are among our most expensive conditions to treat. This is no idle exercise. According to a study in November's American Journal of Public Health, it costs $494 billion annually to treat non-institutionalized U.S. adults for those diseases and their complications. Delaware alone spends $800 million on chronic diseases. How do we fight these threats to our physical and financial freedoms? A problem this big requires more than one person to tackle. That's why a number of Delawareans just hit the ground running to search for solutions as part of our new Delaware Council on Health Promotion and Disease Prevention. They're tasked with offering substantive solutions to feed this growing fight. The coordinated effort includes areas economic development, which requires a healthy and active workforce to succeed, agriculture, whose locally grown produce items could be a healthy and economically sound answer to some of the childhood obesity problems, transportation, which can help individuals literally get moving to reduce their risk of chronic disease, and our kids department, which has seen the hard science around the generations of costs that could come from the recent and rapid increase in pediatric obesity. The good news is early work is showing that even small steps can make a big difference. Authors of a recent study project that initially, Delaware could save $33 million a year and eventually $92 million a year if the prevalence of diabetes and hypertension decreased by a mere 5%. Even small steps aren't easy when it comes to combating chronic and preventable illness, but we have a personal responsibility to try in a way that helps restore our financial and physical freedoms and keeps Delaware moving forward.
Hello everyone. I want to remind all Delawareans eligible for Medicare that Medicare Part C, that's Medicare Advantage, and Medicare Part D, that's the prescription drug program, their annual open enrollment season is going on right now through December 31st of this year. This is an important time of year for Delaware seniors to make sure that they're getting the best benefits that Medicare has to offer. Starting January 1st, 2011, Delaware's 140,000 Medicare beneficiaries will also be able to take advantage of several new benefits as a result of the Affordable Care Act, and they include the following: free annual physicals without co-payments, co-insurance, or deductibles, free annual preventive screening for diseases like Alzheimer's and dementia, and seniors with high prescription drug costs will get a 50% discount on prescription drugs while they're in the donut hole that we've all heard about. Beginning on January 1st, all Delaware seniors who are Medicare eligible should take full advantage of Medicare's new, potentially life-saving benefits made possible through the Affordable Care Act. With that in mind, let me just say thanks very much. Best wishes for a happy and a healthy New Year.
Watch WITN on the web. www.witn22.org. Watch live programming. Check out past City Council meetings. Catch up with City Committee meetings or watch original Channel 22 programs. www.witn22.org. Online, anytime.
Come and see what everyone's talking about. Refreshments will be served. Check us out on the web